Until late afternoon Monday, 100 people were waiting for their care here at Royal University Hospital. At least 50 more were in the ER, but there were no beds available. It was until after 2 p.m. that one patient was moved to a ward. This comes from Saskatchewan Union of Nurses, and the organization is concerned.
Mental health patients laying on the floor. There were people lined up in the hallways waiting for care. Huge concern about the fact that there were patients on portable cardiac monitors, but being short-staffed and being so incredibly over capacity, there isn't the ability for a registered nurse to actually be there to watch the cardiac monitor.
Tracy Zambory says it's putting patients' lives in danger. It's also causing burnout for registered nurses, some who are considering quitting. She says RUH often oscillates between 150 to 300% over capacity, but that hospital isn't alone.
The situation is just as dire at St. Paul's Hospital and just as dire at City Hospital. No place in the city, period, of City of Saskatoon to move people around, because we're hitting yet again another crisis point in the city for care for people in Saskatoon.
Zambory says Regina is in the same boat. Regina General Hospital is often between 150 to 200% over capacity, and as many as 7 nurses short on staff. Zambory says they also regularly have 50 to 60 people waiting in the ER. Yorkton ER is also short-staffed and patients are being sent to Regina. But the general was struggling so much, some patients were bypassed to Pasqua Hospital.
Up to 3 hours they're on bypass. They're only accepting, traumas, strokes, pediatric type patients, and the rest of them are having to go to the Pasqua. So you can imagine what's happening at the Pasqua in Regina. It once again is being overrun as well with very, very ill people.
The health minister says he needs to verify this information, but he's not surprised by the concerns. Paul Merriman also says he thinks that the government's solution to hire more healthcare workers is having an impact.
I think it is stabilizing things out there. When we put 160 doctors, 101 specialists, and 59 family physicians in the system in the last 18 months, that is making a difference. 72 nurses that we've just hired, the nurses that we're bringing over from the Philippines, they are all adding into the system. There isn't going to be one quick fix in a month that's going to alleviate all the pressures.
But Zambory says the emergency rooms across Saskatchewan are in dire straits. She says the province needs to find an immediate solution before the whole healthcare system collapses. Pratish Dayal, CBC News, Saskatoon.